The Porter Health Clinic provides low-cost medical and dental services out of a cramped two-room office and travel trailer. With money from a federal stimulus grant, it's refurbishing this building so it will have a proper clinic.
We'll have 6 exam rooms for medical, 3 dental chairs for our dental.
Arkansas Verdigris Valley Health Centers operates the Porter Clinic, which can offer low-cost care because the majority of its funding comes from federal grants.
Right now we're about 65% reliant upon federal grant money. That encompasses 65% of our revenue needed to keep the center open. We get 2 to 5% from state, depending on the patient flow and the type of patient that it is. If it's a self-pay patient, the state steps in and pays a little more, of course, than you would with a Medicaid or an insurance patient.
The clinic's current federal grant runs out next Monday. It's anxiously waiting to see how the U.S. Senate will vote on a bill already passed by the House. That measure slashes $1.3 billion in funding for community health clinics. Oklahoma has 6 such clinics in areas with high poverty rates and little access to affordable health care. Their clientele?
Mainly uninsured and underinsured patients.
Last year, the Porter Clinic served 1,500 patients. Those with little or no insurance pay for services on a sliding fee based on their income.
We see everybody. We do pediatrics, women's health, geriatrics. We treat everyone.
Because of uncertainty about how the Senate will vote on community health funding cuts, the Porter Clinic may end up with a new facility and little or no money to see patients. Alan Parnell serves on the clinic's board. He says if the cuts are drastic, some employees may also lose their jobs.
It's just like any other business. If you get cut, especially if you get cut of your total budget, you're going to have to reduce. You know, we don't plan on ending medical care here, but we would have to make some drastic cuts as far as personnel and hopefully keeping up to where we can provide ample and good medical care here in the facility.
How many services will have to be cut at this and other community health care clinics in Oklahoma, and how many people will lose jobs, will depend on whether the Senate goes along with cuts already approved by the House or votes to scale them back. In Porter for ONR, I'm Cathy Tatom.